Good afternoon, thanks for joining us. I'll start with the usual update on the COVID-19 statistics. An additional 6 positive cases were confirmed yesterday, which takes the total now in Scotland to 18,365. I think it's perhaps worth noting that on both Friday and on Sunday, we saw higher numbers of new cases than has been the norm in recent weeks. Yesterday, 19 new cases were reported. On Friday, it was 18. Now, on any occasion where there is an increase like that, I want to give an assurance that we look very, very thoroughly to see if there are any patterns or particular causes for concern. And with respect to yesterday, the 19 cases that were reported yesterday, we know that 12 of these cases were in Glasgow, and 7 of those, all of which were asymptomatic cases related to one single care home. Now, that is being looked at in much more detail, and all necessary follow-up tests, checks and precautions are being undertaken. I can also report that a total of 550 patients are currently in hospital with the virus, either confirmed or suspected. That's 13 fewer than yesterday, but it includes an increase of 6 in the number of confirmed cases. A total of 6 people last night were in intensive care with confirmed or suspected COVID, and that is the same number as yesterday. And since 5th March, a total of 4,125 patients who had tested positive and been admitted to hospital have now been able to leave hospital. And I'm pleased to say that during the past 24 hours, no deaths were registered of a patient confirmed through a test as having COVID. The total number of deaths under that measurement, therefore, remains at 2,490. Now, this is the 5th day in a row on which no deaths have been reported, but it is worth providing just a little bit of context for the past 2 days. At the outset of the COVID outbreak, registration offices took special steps to allow for 7-day operations, and I'm very grateful to them and their staff for doing so. But some offices are now going back to their usual pattern of being open only in weekdays, although for emergency situations they continue to provide weekend arrangements. Yesterday's figure of 0 deaths is therefore welcome, but it has to be seen in that context. And of course, regardless of the figures for any specific day, it is still important to remember the enormous impact that the virus has had. And I want to convey my condolences again to everyone who has lost a loved one to this illness. And again, thank all of our health and care workers for the extraordinary job that you are doing. Now, in a few moments, the Cabinet Secretary for Health will talk about the resumption of breast cancer screening programmes. The National Clinical Director is then going to say a little bit about the resumption of outdoor contact sports for young people as of this week. But I've got just 3 issues that I want to cover very briefly before then. The first is to tell you briefly about a new contract that NHS Scotland has signed with a Scottish biotechnology firm, E&O Laboratories. E&O have succeeded in developing a new solution which can be placed within test tubes, and that solution helps to make samples of COVID safe so that each sample can be tested as soon as it arrives at a lab, and it therefore improves the efficiency of the testing process. E&O, who've come up with this product in just a matter of months, are now producing their first batch of the solution for NHS Scotland and are also looking to supply other parts of the UK. Their success has already created 11 jobs and they're looking to recruit for 10 more. Now, that's small in the context of the overall impact that COVID is having on employment in Scotland, but it is still welcome and I think it is also significant. This is a good example, and we've seen quite a lot of them in recent months, of a Scottish company innovating in a way that directly helps our response to COVID while also supporting jobs. Second issue I want to highlight is travel. In the coming weeks, as we inevitably start to travel a bit more, as more people return to work, and as some take the opportunity to make shopping trips, to visit friends or visit different bits of the country, that is good news, but please do think about how and when you travel. First of all, and this perhaps applies especially in relation to leisure travel at the weekend, if you go somewhere and it looks busy, our advice is to go somewhere else. Yesterday, for example, at least one road had to be closed in the Trossachs because it was being blocked by parked cars. And we've also heard concerns in other areas, for example, about large numbers of people wild camping in particular spots. So we're asking you to please use your common sense. If car parks are full, move on, and if places look busy, then also move on. Our very strong advice, as you know, is to avoid crowded places, whether they're indoors or outdoors. Campsites will start to open up from Wednesday onwards, so if you do intend to use them over the next few weeks, our advice is to book ahead, not simply turn up on spec. And while public transport services are now beginning to return more to normal, not completely to normal, but more to normal, and physical distancing with safety measures in place has been relaxed to 1 metre for some services, in spite of all of that, we know capacity is still likely to be restricted compared to pre-COVID levels. And that is one reason why we're still asking you to work from home if you can. And if you can't, employers and employees might want to think about other measures such as staggered or flexible working times, which can help to reduce the pressure on our public transport network. But I'd also like to ask people who are in a position to think about active travel. I completely understand why for many journeys people immediately think about using the car. But if your journey is a local one, think about whether it can be made by walking, cycling or wheeling. That won't always be possible, but in quite a few cases it will be a healthy and enjoyable alternative. So as we all travel about a bit more, we all need to think about how and why we're travelling and to take care about it. And if we are able to shop locally or work from home, continue to do that. And also, as I say, consider active travel. If you are using public transport, plan ahead. And if you're able, as I said a moment ago, to travel at less busy times, that will help you and others. And at all times follow safety guidance, including on public transport, of course, wearing a face covering. That brings me on quite neatly, actually, to the final point I want to cover today. Saturday and yesterday was the first full weekend when face coverings were mandatory in shops. And everything I've seen or heard through social media, through other reports and actually through my own brief visit to a couple of shops yesterday, everything suggests that compliance with the new law has been extremely high indeed, and I want to thank everybody for that. It is what I would have expected, but nevertheless it is still welcome. Face coverings are of course now mandatory in shops and on public transport. But it's also worth remembering that they can be useful in other indoor enclosed spaces too. So if you're inside somewhere and it's not easy to maintain physical distancing, it's a good idea to have a face covering on then as well. Indoor shopping malls open today, and you should wear your face covering not just in the shops but also inside the shared spaces in the shopping malls. So my thanks to everyone who is now wearing a face covering. It is a really important way in which all of us can help to protect each other. And that basic message of solidarity, of protecting each other, is the note I want to end on. Today sees some more steps in our emergence from lockdown, and later this week we will see some of the most significant steps yet with the opening of more indoor premises. As I've mentioned, today indoor shopping malls have opened up, organised outdoor sport and play measures for children, and some routine dental treatment has restarted. As these services reopen and as we all leave the house a bit more than has been the case over the past few months, it becomes ever more important that we take the basic steps to avoid the virus spreading again. So I would ask you to remember the facts that we are asking everybody to abide by. Face coverings in enclosed spaces like shops and public transport. Avoid crowded places, whether they're indoors or outdoors. Clean your hands and clean hard surfaces regularly. 2 metres distancing remains the general rule we're asking you to abide by, and self-isolate and book a test if you have symptoms. If all of us remember and abide by these 5 steps, then as we get out and about a bit more, we can still help to keep the virus under control. So my thanks for your cooperation so far, and I appeal to you to continue to cooperate with that basic public health advice. I'll now hand over to the Health Secretary before Jason Leitch will round off our opening remarks, and then, as usual, we'll go to questions. Jeane.
Thanks very much, First Minister. Today I want to talk briefly about 2 important areas. The first is the resumption of the breast screening cancer programme. As you know, on the 30th of March, we took the difficult decision to pause our national screening programmes based on expert clinical advice and a very careful assessment of risk. We have now resumed the cervical abdominal aortic aneurysm and diabetic retinopathy screening programmes from the end of June, very early July. And now I'm pleased to say that NHS boards will resume the breast cancer screening programme. So anyone who was invited for a breast screening appointment before the pause at the end of March and who was either unable to attend for any reason or had their appointment cancelled will receive a letter in the coming weeks. If your appointment was cancelled by the breast screening service, then the letter will give you a specified timed appointment. If you couldn't make an appointment yourself, then you will be given an invitation to contact the screening clinic to make a new appointment. And invitations for breast cancer screening for those who would in normal course be due an invitation now will slowly start to resume this week as well. There will be no change to the screening test itself, but additional measures have been introduced to allow the screening to take place in a safe environment. Staff will, of course, wear the necessary personal protective equipment, and appointments will be staggered to ensure that waiting areas are quieter and physical distancing can be observed. It will take a bit of time to get the service fully up and running again, but it is an important further step in restarting our important NHS activities. The other area I want to briefly cover concerns visiting, and I want to remind you of the changes to hospital visiting for non-COVID areas that come into play today. Patients will be able to have a visit from one named visitor, with the visits agreed in advance via the ward that is being visited. This is in addition, of course, to essential visits which have been allowed throughout the pandemic. As a visitor, you will need to wear a face covering, practice good hand hygiene, and you should not visit if you have any COVID symptoms at all. Physical distancing should be maintained where possible, even if you have previously been in the same household or social bubble as the person you are visiting. This is because the risks of infection change and can become higher once someone is being treated in hospital. And you will be asked to provide your contact details, because that will allow our public health trace and protect colleagues to contact you if they need to. Visits will be made by pre-arranged appointments to ensure that the number of people in a clinical area at any one time is limited. And please do not bring in food parcels, flowers, balloons or similar items when visiting. As before, COVID areas and hospitals will remain restricted to essential visitors only. As scientific advice and the evidence permits, we will continue to review whether we can allow more visitors, and we will, of course, let you know when we can do that. Meantime, updated guidance on hospital visiting, as well as a visitor leaflet which sets out what you need to do and how to arrange that visit, is available at the Scottish Government website on www.govscot Publications Coronavirus COVID-19 Hospital Visiting Guidance. Thank you.
Thank you, First Minister. As we enter phase 3 of the route map in these few days, I'm delighted that outdoor play and organised sport for children and young people can return. We've long known the benefits of exercise, the positive impact on physical and mental well-being. We know that organised sport can also teach important life skills to kids and young people, like perseverance and discipline, resilience and accountability, and social skills like communication and teamwork and conflict management. But perhaps more importantly, and most importantly, it's also good fun. There is now no longer a limit on the number of households that young people under the age of 18 can meet each day, and children aged 11 or under can play without physical distancing. From today, organised contact sports can return for ages 17 and under. This includes full contact with no physical distancing required only on the field of play. So clubs, schools and community groups will be able to organise sports for these ages of young people. Sports Scotland will provide guidance to most sports, and the Scottish Football Association and the Scottish Rugby Union already have excellent guidance ready to go online today for parents, for clubs, for carers and for the young people themselves. The more general guidance is available at Sports Scotland. These include the need for a COVID officer, somebody responsible for safety at the location, a register of attendees, and of course, strict hygiene measures. It's very important. This exemption is for on-field contact. Once you cross the white line back to the other side, you are no longer exempt from the physical contact restrictions. Thank you.
Thanks, Jason. We will go now straight to questions. Glenn Campbell from BBC Scotland is first today.
Hello, First Minister. On face coverings, the wearing of them seems to be catching on to some extent in Wales and possibly in England. But why, in your view, is the mandatory approach better than relying on what one minister called the good sense of the public? And also on preventing cases of coronavirus being imported into Scotland from other parts of the UK and Ireland. Can you give us any indication of what circumstances would require you to take action and whether quarantine is the only option or are there other measures you might consider?
Well, on that last question, our preference, of course, is that where there are outbreaks of cases in any part of the UK, good local outbreak management, where appropriate with travel restrictions, such as the kind of outbreak management that we're seeing in Leicester right now, would apply. If though we believed that transmission was out of control and not being managed in a way that gave us confidence and therefore there was a risk to Scotland, I've said we will keep all options under review. But I don't want to be in that position because I want to see transmission rates and the prevalence of the virus continue to fall, obviously in Scotland, but in all parts of the UK as well. But like I think any other leader doing their job properly across the world right now, from a public health perspective, we have to be prepared to consider all options to protect the populations that we serve. And that's the approach that I'll continue to take for Scotland. On the point about face coverings, we didn't make face coverings mandatory in shops at the same time we did in public transport. Why do I think the mandatory approach is better? My experience, and it is now just the experience of a couple of days in shops, is that it leads to a significant increase in the people complying. I think we've gone in Scotland from it being pretty patchy up until now to, as of Friday, compliance probably been quite close to 100%. Now, I don't take that for granted. We have to see what compliance is like next weekend and the weekend after that. But certainly, both from the anecdotal feedback I've had and, as I said, what I observed with my own eyes yesterday and in the couple of conversations I had with some shop workers while I was in shops yesterday, compliance is very, very good now that we've made it mandatory. So, however we get there, I think the important thing is that we have now very, very high compliance, because we know, and this is where I think the scientific opinion is moving in the direction of thinking that face coverings do confer benefit. I think that is the most important thing. So my thanks to everybody who has got us to that position, and my plea to everybody is to stick with it. Ross Govins from STV.
Afternoon, First Minister. You mentioned this week as the most significant in the easing of lockdown. As we see these variations in daily cases, is it simply inevitable we will continue to see further spikes as we continue to have more contact, travel further? And how alarmed should the public be in these variations?
At the moment, I don't think the public should be alarmed. As I said on Friday, and I'm saying again today, when there is what appears to be a spike in cases, and remember, the 18 on Friday, the 19 yesterday, those are still very low numbers, but a bit higher than they have been more generally for the last couple of weeks. When that happens, we explore these very, very thoroughly. And based on the investigations thus far, there are explanations. They don't point at this stage to a concern about accelerating community transmission, but we're not complacent about that. I don't want to see anything about this virus as inevitable in terms of it running or increasing again in terms of the transmission of it. But as I say every day here, to the point where I know you're probably all getting sick of hearing me say it, that is down to us. This virus will spread again if we give it a chance, if we give it half a chance, a quarter of a chance. We know it's highly infectious and we know it's very dangerous, and we know that it is accelerating across the world. Jason might want to say a bit more about the global picture in a minute, but this is not a virus in decline globally. This is a virus that is still accelerating. So everything about it tells me that we must stay on our guard. We can't stay in lockdown forever because it does other harms, which is why we must gradually bring ourselves out of lockdown. But as we come out of lockdown, a couple of people have asked me, well, more than a couple of people have had quite a few emails saying, why now, when the levels of the virus are so low, are we making face coverings mandatory in shops? Well, it's because we are going out and about more now, we're going into shops more now, that these measures become more necessary. And that's true of all of the measures in the FACTS campaign that I keep talking about. If we all do that, if we all take really, really good care, then we can keep it under control. But it doesn't take much for it to spread, which is why I'm afraid you're going to hear me banging on about these things probably for quite some time to come. Jason, do you want to say a bit more about the global picture?
A little, perhaps. The WHO is very clear each day that this pandemic is increasing, not decreasing. It is not under control globally. The WHO, if you'll recall, call these things public health emergencies, and they have a number of them over the last decade. None has looked like this, not even close to looking like this. 12.5 million people have had this infection, and 600,000 have died globally, at least. In some countries, there's very little testing and very little registration of death, so it's potentially much, much higher. Yesterday was the biggest single increase since the pandemic began. 230,000 people caught this virus yesterday and had a positive test. So Scotland is doing very well, but, and I say this every time I'm here, we are not complacent and we must not be complacent. It can run out of control so quickly. There's no suggestion, as the First Minister says, that there is a localised community outbreak in any of the numbers we've seen over the last few days, but we're very, very vigilant and we need you to follow the guidelines to allow us to keep those numbers low.
Becky Clark from Global.
Good afternoon, First Minister. We visited a beer garden in Glasgow this weekend where no contact details are being taken, even when customers are offering them. How concerning is it that some pubs are breaking these rules just a week into being allowed to open? And what action will be taken against pubs if they continue to operate that way?
Well, the advice is very clear and it's very important. So, you know, if you want to pass us details of the beer garden, we can make sure they're contacted to be made aware of the advice. But we're not asking anybody, beer gardens or individuals, to follow any of these measures for no reason. It's vital that if there are outbreaks in a pub, for example, that then our test and protect system is able to quickly contact trace. And that is much easier if contact details are taken. So we're asking for these things for a purpose. Now, this week marks the reopening of indoor hospitality, as I think you heard Jason and I say on Friday. One of the steps that I'm most nervous about, because we know the risks of indoor transmission are much higher than outdoor transmission. But as I say, we can't keep everything in lockdown forever, so we have to try to get the country back to something closer to normality. But if people or businesses don't comply with these rules, we will be back where we started, quicker than any of us care to consider right now. And, you know, again, you've heard me say this before. I look at Melbourne in Australia right now. A few weeks ago, I had levels of infection lower than Scotland, and it is now dealing again with a serious outbreak and is back in a form of lockdown. So this can change, you know, quicker than makes any of us comfortable, and it is incumbent on all of us. If we don't want to go back to a position where pubs are closed and we've got more severe restrictions again, then follow this advice, and that applies to individuals and it absolutely applies to pubs as well. Neil Pooran from PA.
Thanks, First Minister. If I can ask about homeless people who've been given emergency accommodation during the crisis, are you still able to guarantee that no one who's been given this temporary accommodation will have to go back to living on the streets? Especially in the light of the UK government's rules on people who have no recourse to public funds? And more generally, does this crisis give Scotland an opportunity to eradicate homelessness and rough sleeping altogether?
Well, we certainly don't want to see anybody move back to rough sleeping or sleeping on the streets. We can provide you with some information about the work that we are doing, both related to the crisis, but more generally around tackling homelessness and rough sleeping. And of course, as you will be aware, before the COVID crisis, we had a real focus through the recommendations of a task force that we had of experts that made a number of recommendations for us. We had a real focus on the housing first approach of getting people into settled accommodation and then putting support around them as necessary. So we don't want, as we come out of this crisis, to go back the way, and I'm certainly happy to provide some of the work that we're doing in partnership with local authorities to try to make sure that that doesn't happen. Vivian Aitken from the Daily Record.
Good afternoon, First Minister. I'd like to speak about care homes. First of all, my connection broke a little bit, so I may have misheard you, but I thought what you said at the start today was the 19 new cases, 12 of them are in Glasgow, and 7 had connections to one care home. If that's the case, and I didn't mishear you, are there plans to have a look at a real cluster effect in that care home? And also, Donald McCaskill had said at the weekend that GPs, public health, are refusing to test new residents to care homes who come from the community, and basically said that what's the point in testing people that are coming from hospitals if we're not going to test people from other parts that are going to care homes and may bring it in with them. Just really wondered what you felt about that.
On the latter point, I'm going to hand over to the Health Secretary, who's been discussing these issues. On the first point, you heard me correctly. So of the 19 cases yesterday, 12 in Greater Glasgow and Clyde, and 7 of those in an individual care home. So the answer to that question is yes, all of the appropriate steps have been taken, including testing, other checks, and all of the precautions that you would expect. And we'll be looking very closely at that situation over the days to come. Jeane.
On the issue that emerged over the weekend, I spoke to Donald McCaskill yesterday from Scottish Care on the back of the information that he was raising. My understanding of, well, we're gathering the data now from Scottish Care, is that this is certainly not widespread, but does appear to be the case that in some instances either GPs or directors of public health are assessing whether or not individuals who are to be admitted into a care home from their own home, from the community, should be tested. Now, the guidance and the requirement from me is crystal clear on this, and that is that if you are to be admitted to a care home, unless there is a clinical reason not to do this, then there should be one negative test before that admission, and then, of course, the individual needs to be nursed and looked after in their own room in isolation for the 14 days to be absolutely sure that even with a negative test, no symptoms are going to be developed. And of course, the NHS remains on an emergency footing. And so once we have finalised all the details from Dr McCaskill, then I will be making it very clear to those parts of our health service exactly what it is that they're required to do, and then we will be seeking assurance diligently to make sure that they're doing it.
Daniel Sanderson from The Telegraph.
Thank you, First Minister. Can I just ask about the issue of dentists, which is reported in the Scotsman today? Is it acceptable that people who can afford to go private are able to get things like fillings while people who rely on the NHS can't? And if not, what do you plan to do about this? And also, can I just ask Professor Leitch about the sort of spike in cases on Friday and Sunday? You mentioned that quite a lot of these cases were asymptomatic in the care home, and I just wondered if you could expand a bit on, the significance of that and how that might affect things going forward. Thank you.
Okay, I'm going to hand over to Jason on both of these points. I think the position in dentistry is not quite as characterised there, but Jason has more expertise in dentistry than either of the other two of us here, and then he can give his views on the asymptomatic nature of some of the cases.
Finally, a piece of the puzzle I actually understand from having worked in it over the years. There is a difference between dental provision in different places, but the Chief Dental Officer has a very clear route map back to full dental care. Different timings from the route map that you hear us talking about all the time. Emergency dental care and drilling, just as you described, has been available on the National Health Service, but it's been available in about 70 or so urgent care centres spread throughout the country. So a dentist has been available on the phone and now in person from today, doing routine care, dentures and orthodontic braces and checkups and other elements of care, and then moving from there to an urgent care centre if that's required. And Tom, the Chief Dental Officer, working quickly to move to the next step of the route map, which would allow aerosol generating procedures to be done in the thousands of practices. We're slightly more concerned about the aerosol procedures, of course, because of the nature of this virus. I wrote with Tom to the private dental practices in the country and asked them very clearly to follow the same route map out as the National Health Service dentists. We have slightly less control over what they do because of the nature of the contracts and the market in which dentistry works. But it was very clear advice that they would follow the same as the National Health Service. So care has been available and it is coming back to full dental care. The Friday and Sunday numbers that the First Minister has discussed, we've looked very carefully at them. There is no suggestion of clusters. This is not a challenge like last weekend and the weekend before where we had a set of cases all connected like we had in Gretna and Annan that was very well dealt with by Defrisa Galloway. But we keep a very close eye on that. It does appear that a number of them were asymptomatic positives within the care home testing regime, which we have used as an evidence-based way of finding that. We know some things about that asymptomatic testing. They're usually not as infective, so they don't spread the disease, but still could. And it's important to find them, particularly in our more vulnerable communities like our care homes, which is why we've introduced that. So I am cautious, but not worried about those two increases.
Okay, thanks, Jason. Rachel Watson from the Daily Mail.
Thanks, First Minister. Can I just go back to the care homes? Can you tell us whether these are residents or workers at the care home, or if it's a mixture? And was this picked up in routine testing? And are you working to find out where that's come from, how it was brought into the home? And also, just on the breast screening programme, do you know how many women are waiting on appointments or missed them due to the lockdown? And do you know how long it will take to get back to normality?
On the first question on care homes, I can't give you any more detail than I've already given you right now. This is still under investigation. If there's more information that we think is either necessary or appropriate to put into the public domain at a later stage, we will do that. My understanding is that the cases, some of them, as Jason's just been covering, asymptomatic in care homes, was picked up through the routine testing. And of course, because we are testing care home workers more regularly now, we can expect to see more of that if the infection is out there and that we picked up in that. But I'm not able to give you any more detail of this at this particular stage. On breast screening, I'll hand over to the Health Secretary.
Thanks very much. I don't have the exact numbers of women who didn't receive their breast screening appointment. They didn't miss it, they weren't missed. We deliberately paused the programme in order to ensure that nobody was missed, and we now know who all those women are who should have had a breast screening during the months of the pandemic, and that's the group that we now go back to and offer those letters, send those letters as I described. So they weren't missed, but we deliberately paused them to make sure they weren't missed. I don't have the exact numbers of that, but we can get that to you. And in terms of how long it takes, well, this is a national screening programme, but each of our NHS boards are working in their own way to their own mobilisation plans. So we will look across all of those to make sure that in terms of a national screening programme, that we have equity for women across the country. But at this point, it isn't clear because we're restarting other screening programmes, as I also outlined, exactly how long it will take before the group that were paused have been caught up with, bearing in mind we're also restarting in parallel with that the normal appointment lines of screening. But all of that will itself take a little bit longer because we need to have fewer people in waiting rooms, PPE is worn, and we need to ensure that we can maintain physical distancing. So in common with all the other restart of NHS services that we've talked about before at these briefings, some of this takes longer in order to ensure it is safe for both the patients and the staff.
Thank you. Chris Musson from The Sun.
First Minister, just back on the care home and the Sunday figures of the 7 cases in the Great Glasgow and Clyde home. Were any of today's new cases in that care home separate to the 7, or indeed any at the end of last week when Greater Glasgow and Clyde had 6, I think. Also, you're not identifying the care home, obviously, but NHS Greater Glasgow and Clyde is a big area. So can you at least tell us in which council area it's in? And just to clarify, just on in general on these stats, can you publish daily positives tests by council area, not just health boards? I think this is the way that they do it in England, or at least those are available in England. Thanks.
On that latter question, I don't know whether that's possible. We have always published them by health board area, which is, in my experience, what we would tend to do. But if there is another breakdown of these we can give, I will certainly look into that and let you know. I'm not able to give any more information about the care home right now. If it is necessary or appropriate to do that, Greater Glasgow and Clyde or the Scottish Government will do that later. Likewise, I have no reason to believe at the moment that today's cases are connected, but as you will appreciate, today's cases will still be under investigation, so I cannot rule that out at the moment. But we will say more about that when these investigations have allowed us to be able to answer that more definitively. It's just the time and the state of these investigations mean that I literally don't have any more information than I'm giving to you right now on the nature of today's cases.
Can I just to clarify then, there's 7 cases yesterday are the only cases at this care home. There wasn't any at the tail end of last week either.
These are, so I'll let Jason, my understanding is that the Friday's cases and Sunday's cases are not connected, but you will appreciate there is a need to properly look into that and make sure all appropriate contact tracing is done. But Jason may want to say a bit more about that.
I don't know, I don't think that any of these 3 days have got connections across them. But it wouldn't be completely ridiculous if some of them were, and that's exactly what will happen. Remember, tracing happens in both directions. You forward contact trace to contacts to the positive case, but you also, if you can, you backwards trace to where the infection may have come from. That often isn't possible, but if it is, then that's what the health protection teams will absolutely be doing. And Test and Protect is designed to do precisely that.
So we'll give as much information as these investigations take place. And of course, the health board breakdown of today's 6 cases will be published later on if it hasn't, later on around 2 o'clock as normal. Gina Davison from the Scotsman.
Hi, thank you, First Minister. Question really is for Professor Leitch. Just going back to the dentist issue. Given what you said in your answer to Dan Sanderson, are you suggesting that private dentists who you've written to and who are now doing routine procedures with aerosol agents are going against your advice? And are they putting patients in some kind of danger if NHS dentists are not allowed to do these kind of treatments yet? And also, can I ask, in a kind of similar vein, why sports massage therapists who work with people in pain are not allowed to resume work when physiotherapists are working, and now even beauticians who might offer some kind of massage are able to work? I know that the regulatory body for the sports massage therapists believe they're being discriminated against and that your communication and consultation with them has been poor. So I just wondered what you might have to say to them.
Dentists are very, very well trained in infection and prevention control. They work in slightly different ways according to which piece of the dental puzzle they work in, but I know they all have adequate PPE, they are inspected appropriately, so I don't think patients are at risk. However, coming through the route map to the recovery of the National Health Service, we have set in place some guidance for optometry, for podiatry, for dentistry, and we asked in my letter with the Chief Dental Officer and others that the private sections of our healthcare system, including our private hospitals, followed the same pathway out as the National Health Service. So that guidance is there and people can read it. Tom, the Chief Dental Officer, is very keen to get National Health Service practices back just as soon as we can with the full gamut of care. The massage therapy, complementary therapy and beauty therapy challenge is a challenge, you're absolutely right, and different sectors need guidance at different times. We are keen to get all of those businesses back just as soon as it is safe to do so. And the Cabinet Secretary for Health has asked for advice from officials today about the differences between these elements, what guidance we can have in place. And remember, beauty therapy isn't opening until a week on Wednesday, so still about 10 days to go. So it may be that if we can put everything in place in time, we may be able to do more a week on Wednesday with some of these other elements. As soon as you open one sector, it turns out that sector is slightly more complex than you anticipated, and you have to find all the other elements. So complementary therapy and sports massage are in the mix for that guidance that the Cabinet Secretary has asked for.
Tom Martin from the Express.
Hi, thanks. Just picking up on the Glasgow care home issue. You mentioned briefly you said appropriate steps were being undertaken. Could you briefly outline what they were? Presumably, it's been closed to new admissions. That would be one of the things. But just if I could get a brief outline of what the appropriate steps are that are being taken on this.
As I've said a couple of times, I'm not able to give more information than I have done right now, but there'll be a variety of things underway, and obviously we'll be liaising, as you would expect, with the Health Board and the Public Health team there. The Health Secretary may want to say a bit more about it, but those steps will include testing, other checks around infection prevention and control, and any other precautions that need to be taken. But these things, of course, in the first instance are overseen by the local health protection team, as is their responsibility.
Thanks. Just to say a couple of points. First Minister is right. So the standard procedures would be that there would be closed to new admissions, that testing of all staff and residents, well, testing of all staff is now a weekly occurrence in any event. Other residents would be tested where that is clinically appropriate. Remember, for some individuals, the test itself is too distressing and difficult to undertake, but where it is possible, testing will be undertaken. There will be additional support available if it's needed in terms of infection prevention and control. And of course, our primary care teams are now wrapped around all our care homes to make sure that whatever clinical support and help is needed is available too. So that would be standard, and that will be happening in this instance.
Thank you very much, First Minister. A new study out today by Edinburgh University has found that having asymptomatic COVID-19 contacts isolated at home for 14 days is almost 30 times more expensive to the economy than testing them every day. I just wondered if the Scottish Government is considering a policy of testing traced contacts every day, and if there's enough testing capacity to undertake such a policy.
We have, Jason will maybe want to say a bit more about this in terms of the efficacy of testing in different circumstances. We have ample testing capacity at this stage. Obviously, we're not complacent about that, as we would expect it to come under increasing pressure as we head towards the autumn and winter months. The generality of your question, we keep these things under review. You've heard us speak before about the limitations of testing. We're doing much more of it now, but still, a negative test on one day doesn't absolutely guarantee that a person will not be positive with the virus and therefore not infectious. So we have to balance these things carefully. But Jason, do you want to say more about that particular scenario?
Kieran, I'm not sure what daily testing would tell us. The WHO and the science tells us that the incubation period is on average 5 to 7 days, sometimes 10 to 14 days. And therefore testing every day would only tell me that they were negative on the Tuesday. It wouldn't tell me what was going to happen on the Wednesday. So if it were helpful in a sense that we would let people go to work and they would only be infective on the day they were, it just doesn't help us. Now, there are ways that you can use testing for elite sports bubbles or for other sectors, for oil and gas, where you can do testing regularly. You see us do it in care homes. We've decided, using the evidence, it is appropriate to test weekly for those staff. But that's a different thing from daily testing and then making a decision about leaving the house based on that daily test. That doesn't work scientifically.
Tom Gordon from the Herald.
Thank you, First Minister. This is a question for Professor Leitch again. Can I just press you on this stuff about the dentists? You said you gave the private practices very clear advice. Are you aware of any private practices which have not followed that advice, but have moved ahead quicker than you would have liked? And if they are doing that in a safe manner, why cannot NHS practices do the same at that quicker pace?
And I think the Chief Dental Officer is looking at precisely that second question and will make choices. Remember, we're making those choices for a broad range of dental practices across the nation. So the upper close in Glasgow might look very different from the fancy new community centre in Glasgow or wherever. So Tom, the Chief Dental Officer, has got to be very careful about when that route map moves through. And we're confident we have the PPE in place and the training in place, but we just need to be absolutely sure that all the elements we need for the National Health Service to open. I am not aware of specifically anybody doing anything that I am uncomfortable with, but I have seen reports in the media and from friends and colleagues that some private practices are moving faster than the National Health Service. Again, I say, these people are professionals, they are regulated, they are care teams, they are responsible, and I'm quite sure they'll be putting everything in place that needs to be in place to protect their population and their patients. Test and protect, remember, applies in these settings just like it applies everywhere else.
Thanks. Tom Magner from Carers World Radio.
Thank you, First Minister. 10 days ago, you published a 4-stage approach to visiting adult residential care homes. Our viewers in Scotland are telling us they're still confused about what stage you're at now, so an update on that would be good. But leading on from that, and general concern over the effect of asymptomatic people, if the claims over the refusal of tests for new care home admissions from the community are true, doesn't all of this jeopardise your careful 4-stage approach and put carers and the people they care for even more on edge?
Well, the Health Secretary, I think, has been very clear about the policy in respect of testing for new admissions, but Health Secretary has been taking very great care over the policy of visiting care homes. So I'll allow her to update on that.
Thanks very much. So all through the first phase of the pandemic, there was always an exception to the no visiting policy in care homes, and the no visiting policy, as I'm sure everyone understands, was there, difficult though that was, both for residents and for their family members and indeed for staff. It's there in order to protect and prevent the inward transmission of the virus into the care home. So there were exemptions to that for people who were at the end of life, and particularly from residents who perhaps suffer from dementia, for whom the absence of any kind of regular visiting was causing significant distress. We've now moved from that position to, if you like, phase 1, where for those care homes who have not had a COVID case, an active COVID case, for 28 days, and some have not had a COVID case at all, there is now one designated visitor for each resident. The resident, of course, chooses who their designated visitor is, and they can visit outdoors. That is where we are at this point. But of course, as with hospital visiting, we continue to review when we can move to the next stage, which would, when we can do that, we're not there yet, permit one designated visitor indoors. There is a clinical group that is actively working and providing specific advice for care homes and care home residents, and they have developed a 4-phase plan for restarting visiting in those stages. But moving from one stage to another depends on all the information and the evidence that all viewers, and I know, Tom, you too, are very familiar with. So when we can move to the next phase, we'll make that very clear and very public. But right now, for each resident, one designated visitor and visiting outdoors with all the precautions about contact details, hand hygiene, face coverings, and so on.
Okay, thank you. And last today, Paul Mallock from the Courier.
Good afternoon, First Minister. UK Stats Authority last week wrote to the Scottish Government about the use of unpublished antibody testing data in a press release that was put out into the public at the end of last month. Are you able to say what type of antibody testing was used for these 4,000 antibody test results and when the results will be published publicly?
I don't have that information to hand right now, but I will get you that. As we've said before, we've been using antibody testing for surveillance purposes, but I'll get you more information on exactly what the answer to your question is. So my apologies for not having it to hand right now. That concludes the questions today. My thanks to all of the journalists, to Jeane and Jason, and to Jill, our BSL interpreter for today, and my thanks to all of you for joining us. As always, I will leave you with my usual encouragement to remember facts, face coverings in enclosed spaces, shops and public transport being mandatory, avoid crowded places, indoors or outdoors, clean your hands, clean hard surfaces, 2 metres distancing, and self-isolate and book a test if you have symptoms. If we all keep sticking with these 5 measures, then we can keep this virus in retreat as it is right now. My thanks to all of you. We will see you here again tomorrow at 12:30.